We know that over the next 2 decades or so, the number of HIV-infected persons who are older than 50 is anticipated to triple from about 4 million to 12 million. And with that, that's a great thing in terms of the success of antiretroviral therapy. But with that comes a lot of aging-related conditions, aging-related disease, and aging-related syndromes. And the challenge for us going forward here in the Caribbean, Latin America, and the rest of the world for the HIV-infected population to make them live not only longer but also healthier is to address these aging-related syndromes, aging-related disease, and think about the social and economic factors to address these conditions, but also from a scientific perspective, think about epidemiologic and biological interventions to improve outcomes for this population. We're over 30 years in this epidemic. We know that there have been many people who unfortunately have died along the way, and that has been in the context of scientific advance not being as far where it needs to be, but also in some contexts just from an access perspective, and access to care, access to medicines, access to life. And we want to, now we are definitely, because of significant advocacy and communal involvement, advocacy on the part of persons living with HIV, advocacy on the part of folks working in this area for so long, we have had some success in advancing the cause of persons living with HIV in terms of quality of life and longevity of life. So I think we have transitions. We can't go back. We don't want to go back. We want to make sure that the resources are there to ensure that we can always go forward. But so as we go forward into a new frontier, thinking about an older HIV-infected population, we want to maintain the gains that we've had while still pushing forward to get new gains in terms of addressing these new aging-related conditions that are affecting this population.